Today we're going to talk about the revised COVID-19 testing guidelines that came out from the CDC last week. It's causing a little bit of a stir, so let's talk about it. So they said on their website to consideration for who should get tested are people with symptoms of COVID-19. Then there's a list of 11 symptoms. And then number 2 is patients who have had, or people who have had close contact with confirmed cases of COVID-19. Close contacts is defined as within 6 feet for 15 minutes. That's the definition of a close contact. And number 3 is anyone who's been asked or referred to go get tested from their healthcare provider. They go on to say that not everyone needs to get tested, and if you are being tested, you should quarantine or self-isolate until your test results come back. So what is causing all this controversy is really the wording of consideration of who should get tested. Who they're listing are the people who should get tested. There's a group of people who definitely should get tested. There's a group of people who definitely should not get tested. And then there's a big group of gray in the middle. But the people that they're listing, people with symptoms and people with close contacts of a confirmed case, those are the people who should get tested. Definitely go get tested. We'll talk about, the gray area. People who should not get tested, if I go to the grocery store and I'm wearing a mask and I'm washing my hands, I don't need to get tested. That's like an everyday kind of thing now. I'm not going to test myself every day to make sure that I don't pick up coronavirus at the grocery store, okay? But the people that they listed, those people should get tested. That's not a consideration in any medical professional's mind. Those people definitely should get tested. I'm new here on YouTube, so let me introduce myself. I'm Dr. Rachel Johns. I'm an internal medicine doctor specializing in hospital-based medicine in Southern California. My passion is educating patients on healthcare topics that matter so that you can live your best life. Please subscribe to my channel so you don't miss any of this important information. So let's go through a couple scenarios and we'll talk through the CDC guidelines and see if we can make some sense out of these things. So scenario number 1, mom calls. She's not feeling very well. Doesn't have any energy, maybe a headache, just vague stuff, right? Nothing to pinpoint any specific disease that she has. She doesn't really go out much. She lives alone. She's, getting on in years. So you're a little worried about her. You go over to check her out, make sure she's doing okay, she's eating okay. You might spend the night with the plan that, if she doesn't feel better tomorrow, I'm going to call her doctor and make sure she's, get her checked out, make sure she's doing okay. So the next day, your sister calls. She knows you have to go to work, so she's going to take over from mom so you can go to work. Great. You go to work, you go live your life, and a couple days later, your sister calls and says, mom got tested positive for COVID-19. So the CDC says you should consider getting yourself tested. You now have a confirmed case that you've had close contact with. I say, definitely go get tested. That's not the question of whether or not you should get tested. The real question is when you should get tested. So the tests are not 100%, okay? They're really good, but they're not 100%. No test is 100%, but they are less accurate when they're done early. So the test requires a certain number of virus particles in your body to turn the test positive. So that means it needs time. It needs time to set up in your system and produce enough virus particles to turn the test positive. So what you don't want to happen is go test too early, get a negative result, which we call a false negative. If you have the disease and have a test that's negative, we call that a false negative. So that gives you this false sense of security that, oh, I tested negative, I'm okay, I'm gonna go to work, I'm gonna go out in the community, I'm gonna go see my friends, it's Labor Day weekend, I'm gonna go to the backyard barbecue, and you are actually positive, but you have this false test, and then, you go around and you're just spreading coronavirus everywhere. So we don't want that. So unfortunately, you have to wait to get tested. And so what we're finding is the optimal time is about 3 days after your symptoms start And if you never develop symptoms, then or you haven't developed symptoms yet, it's 7 to 8 days after your date of exposure. So when your sister's calling you in this scenario, you're about 3 days out from your exposure with mom. It's really too soon to go get tested and to have that test be accurate. And unfortunately, in the meantime, you are going to have to self-isolate. And I know that's really hard because you have a life to live, you got to go to work, you got to pay bills, and I get that. If I don't go to work, I don't get paid and I can't buy groceries. But to do the right thing for our community, we have to self-isolate, we have to go get tested. It's just the right thing to do. So let's talk about another scenario. I mentioned backyard barbecue. It's Labor Day weekend. People are going to have barbecues. And first of all, I'm not saying don't go, okay? Human beings are social creatures. We need social contact. We need to go out and be around people. We just need to do it safely, okay? So that's what I'm going to say about that. So people have this feeling that outdoors is more safe than being indoors, and that may be, okay? I'm not discounting that idea. I've gone to backyard barbecues at the same time. So it is outdoors, there's more air ventilation, people can spread out more, so it does seem safer. But at the same time, we are seeing news stories almost every day of all these, outdoor get-togethers, an outdoor wedding, half the people there got sick, so it still happens, okay? So just because you're outdoors and you can spread out, it doesn't mean that you're not going to get it. It just means that the risk is a little bit lower than being inside. Okay, so take that for what you want. So we're going to this backyard barbecue. Everything seems cool. Everyone seems healthy. You have a great time. It's great. A couple days later, the host calls and says, one of the guests at the barbecue, we'll call him Bob. Bob went and wasn't feeling well after the barbecue. He went and got tested. He's positive. All right, so let's talk about the CDC guidelines, talk about close contact, right? You have a confirmed case. Did you have close contact with Bob during the barbecue? You have to think back. Did I sit next to him while we were eating? So go back and think about it. You want to think about what kind of exposure did I have? Was it, within 6 feet for 15 minutes? But, so you might not be in that a category that definitely you should go get tested. You're probably more in that gray area. But in this case, if he tested positive, you should probably go get tested. Everyone at that barbecue should go get tested. And again, you have to wait. It's only, it's Thursday. The barbecue was Labor Day Monday. It's too soon to go get tested. You have to wait for those tests to be accurate. And again, I know it's hard, but you have to do it. So let's muddy up the waters a little bit more. We're still going to stay with the backyard barbecue. Bob's not feeling well. He went and got tested, but he's negative. Okay, so now it's Thursday, 3 days after the barbecue, and he's negative. So the host calls you and say, hey, I just want to let you know, Bob wasn't feeling well. He went and got tested. He's negative. Everything's cool. Really? So let's think about this a little bit. Again, we need to ask some questions and get some more information. It's only 3 days after the barbecue. When did he start getting symptoms? Did he get tested too early? What kind of test did he get? Because that matters. There are different tests out there. You want to know, did he have a saliva test? Did he spit in a cup? Or did he get the PCR swab up his nose? So again, ask some more questions, get some more information. It would be really helpful if Bob would wait another couple days and go get a second test. Then then you have a lot more clarity into the situation. And whether Bob wants to do that, that's up to him. You can't force him to do it. So let's say he did. He went and got tested. If he's positive, then again, I think you should go get tested. That's my recommendation. You don't have to. Do with that what you want, but that would be my recommendation as a doctor. You should go get tested if you've had a contact with someone who then turned positive. So let's say his repeat test then is negative. Then he's had two tests. Let's just say they were, 3 days apart from each other. So 3 days after the barbecue, he's negative. He waited another 3 days and he's negative again. You're probably okay to then not get tested, especially if you haven't developed any symptoms. That one, you could actually argue it either way. It's reasonable to still go get tested if you're worried. If you're not that worried, if he's tested negative, your risk then goes down a lot. And so it's reasonable to then not go get tested. So again, we just have to ask the information, ask the questions, get the information, and make the right decision that's right for you and your family. So I hope that sheds some clarity on the situation. If you have any questions, please put that in the comment box below. I'm happy to answer any questions that you guys have. This is a confusing topic, so we need to have some dialogue and talk it through. I'm Dr. Rachel Johns. I'm here to help you control your medical problems so that they don't control you. Bye.